Good morning, good evening, good afternoon all around the world. This is Dr. Bill Williams, and I'm here as part of the Global Summits Institute. We are having an extremely good day. We're in the middle of a series on the Patanars, and today we're featuring Arash Hakhamian in Beverly Hills, California, who's going to speak on a very interesting topic. And you are here, and we are ready to present to you some exciting information. Let's go over and share the screen. See if we can get started with our presentation today.
How are you, Bill?
Arash, I'm going to put on the screen here. There we are. So what we have is the Patanar featuring teledentistry and mobile dentistry today with Dr. Hakhamian. And what I want to do is cover some ground rules and tell you about what's going on with our group. Of course, we are Doctors United, bringing together medicine, pharmacy, dentistry, philosophy, optometry, chiropractic, naturopathic medicine. Any doctor that's related to healthcare can join our group. And we're featuring Doctor to Doctor World's Top 100 doctors. Every class is being built as we speak. We're taking nominations right now. And the nominations for the World's Top 100 includes all the types of doctors. And we're seeking specifically doctors in medicine, chiropractic, podiatry, pharmacy, optometry, those doctors to fill in the world's top 100 classes. We have plenty. We've been overwhelmed by the number of dentists who've joined us. So we're actively looking for 2022, the doctors from those other disciplines specifically. So you can nominate yourself. You can have someone nominate you for the 2022 class. There's a nomination form you can fill out. We've actually got on the screen, we've got the block. You can take a picture of it and it'll go straight to this nomination form. And for those who have an interesting topic they want to speak on, you can apply to speak and book a Patanar where you're the speaker. And there's certain criteria to be a speaker and criteria to be a host. And today we're hosting Dr. Arash Hakhamian on teledentistry. So if you have something that's a service, a product, an interesting idea to promote to the world through these Patanars, this is the platform for you. Now, it's important that we bring out the teaching platform of the future, and I want you all to write down this URL, trimurl.co/global summits, capital G, capital S in the global summits. Write that down and go there, because we want you all to have access to Academy, which is the teaching platform that we're going to be using in the future, particularly as we go into teaching the Universal School of Health and the doctorate degree in business. So this is for all doctors on this platform, all doctors in the Doctor United group. And we want to promote that everyone becomes a member, everyone gets the benefits. The benefits are huge. Can't spend time talking about it today. But what we're going to be having available to you is automation, artificial intelligence technology that runs a lot of our business, that runs our webinar series, that runs our services. It's bigger, better than anything that we can explain right now. But just be aware that if you become a founder, you become more capable as a practitioner to build your business. You become more capable of earning a bigger income. trimurl.co/global summits. And when you do that, you'll be joining in with Dr. Shaw and myself, Dr. Latren, and many other doctors that are in the teaching group. So we invite you to do that. Let's get along right now to the Patanar topic of today, teledentistry and mobile dentistry. And Dr. Arash Hakhamian, he's a well-rounded, experienced dentist of 20 years. He comes from a multi-generational dental family. Originally from Iran, he's practiced in Beverly Hills, California for the 20 years. And he's got a list of things that he's done that's impressive. Anybody who can do all this in 20 years is on the ball and on the go. He's a leader of his own practice group, CEO of the Yes Dental Centers. He's co-founder and producer at Global Summits Institute. He's one of the instrumental people putting all this together, this whole program. He's a fellow in the ICOI. He's been on Smiles at Sea, which I know I've been on that before, so I know exactly how that runs. It's a fun time at sea speaking to a different group of folks. He's been elected to the top 40 under 40 dentists in America. He's a humanitarian. He believes in giving back. It's very important that not only do we do the work in our home offices, but we go and serve others in places where they don't have quite so much opportunity. So from Beverly Hills, he goes to Guatemala and places, Vietnam, all around the world, and has done mission trips for most of his career. He's a board member of the Global Dental Implant Institute. He's a clinician. He's got faculty appointment to the Universal School of Health, which we are putting on starting this August. He's an innovator. He's coming together to bring us some information on DENTULU, which is the teledentistry, mobile dentistry concept where he Uberizes dentistry, essentially. So I'm looking forward to hearing a lot about the innovation that he's brought to the dental profession so that we can network with others in a way that's never been done before. So without further ado, I want to introduce to you our main speaker today, Dr. Arash Hakhamian. Welcome to Dental Global Institute.
Thank you, Bill. Well, what a warm introduction. I appreciate the opportunity to be here. Thank you to all of our listeners from around the world. It's been such an amazing experience working on this doctor-to-doctor ecosystem that's being built on a global scale. Being able to collaborate with not only other dentists, but specialists and physicians. And really, it really goes hand in hand with this paradigm shift that we're having and really just resetting dentistry and resetting how we as practitioners are approaching the overall well-being of our patients. And it's a unique pleasure and honor to be here with you today. How's everything in your neck of the woods, Bill? I think you're in Atlanta, Georgia, right?
We are. It's beautiful. No clouds. Going to get into the 90s, early 90s in this heat of the summer coming up. The swimming pool is ready. The kids are ready to jump in. I can watch them out the window here.
Wonderful. Well, I think the Uberization of dentistry is something I've been interested in for years. We've all seen what Uber has done to not only the taxi industry, but really the car ownership industry, and really has redefined a lot of those, fundamental beliefs of what car ownership and really the taxi industry has really been. And we're doing the same in dentistry, right? We're having these types of discussions, virtually. We're having a lot of our trade shows have gone virtual, and technology has been the driving force behind all this, allowing us to communicate with one another, collaborate with one another. And really this goes hand in hand with how we're using the same technology to Uberize dentistry and take those same fundamental principles that change the taxi industry and apply them to our own. So maybe I'll just jump right into it and share my screen, and we got a lot to cover. So let's see how it goes. So as Bill mentioned, I'm a CEO of DENTULU. Haven't been in practice quite as long as 20 years, but I appreciate all the amazing things that you've said about my career. Today, I want to discuss Uberization and see how this applies to what we're doing. What is Uberization? How can it impact dentistry? And how we can use these principles to better our practices and also better serve our patients. So our company is not related or has any affiliation with Uber yet, but I'll talk to you a little bit about how Uber is getting involved in actually the dentistry and the health industry as well. So I've had a really exciting career. I've been participated in consulting, teaching, lecturing, and I've had several practices in addition to working as an international volunteer. I'm currently CEO of DENTULU, and I'll be sharing a lot about what DENTULU is doing and how we're using mobile dentistry and teledentistry to really promote the Uberization of dentistry. Work closely with the Special Olympics, with Google, and really great organizations that have helped us get to where we are today. So DENTULU is the name of our company. It's the leading teledentistry platform around the world, and the leading mobile dentistry platform around the world. And the topics that I want to discuss today is, some of the use cases for teledentistry, for mobile dentistry, how to get more patients using this technology, new financial opportunities to providers, how to really stay ahead of the future trends that are occurring, and other characteristics of Uberization. So while it may seem like this is a new technology, transmitting data over internet or phone, or this is actually something that's been used over 100 years. We've had EKGs sent over through the telephone. As early as the early 1900s, we were transmitting data to be able to, not only access more patients, but be able to follow up with our patients and share some information with other clinicians. And so we've seen this evolution occur, and everything happens in cycles. I remember the days where, my parents and other clinicians used to do house calls, and we've kind of gone full circle, and now everyone's going back towards providing on-site care. And the same goes with the cycle of telemedicine, being able to transmit data. This is something that we were implementing many years ago, and now we're kind of coming back, and the pandemic has really propelled this, and with the shutdowns that occurred, really put this front and center in not only medicine but dentistry. So if you're not familiar with Uber, Uber Technologies has really revolutionized their own industry. They bring in over $50 billion in annual booking revenue, and there are certain characteristics that Uber brought to their industry that can be applied to others. So it was very disruptive technology. One of the characteristics is that it must have an app. It must be utilizing some kind of a mobile technology. It must be on demand and really provide direct access between the consumer, in our situation, it's the patient, and the service provider, and allowing those customers to have a choice of who to choose, who to schedule with, be able to review and rate that particular provider. And I really go over these as the 5 C's of Uberization, which is control, convenience, customer experience, connection, and comfort. Now, we've seen the Uberization of many other industries. This includes, being able to book a hotel or be an Airbnb, being able to optimize real estate and find a home or find a new office online, being able to really almost eliminate having to go to the doctor in many cases by utilizing the telemedicine aspect. And you can see here on the right-hand side, companies who have really already started the Uberization of dentistry, from Align Technology, Smile Direct Club, Henry Schein, Candid, the Teledentist, Denmat. All these companies are now participating in some aspect of telemedicine and teledentistry. And we also have tons of companies getting into remote patient monitoring. There are so many different types of sensors and gadgets and home monitoring tools that are now being implemented, from fitness tracking to sleep to cognitive health, diabetes care, senior care. And we are now seeing some wearables and some remote patient monitoring tools being implemented in dentistry as well. And we'll go over some of those. So with every different type of technology, you're going to see an acceleration curve. And right now it is, we're in a point where you're seeing really this type of technology intertwined into our daily lives, from Facebook to Netflix to Uber to even communication tools and collaborative tools like Slack, and to e-commerce technologies like Amazon. We've seen how this Uberization has really permeated our day-to-day lives, and we can access just about everything we want on our mobile phones. But with every technology, you're going to see this adoption life cycle where you initially get this huge tech trigger. Everyone's interested, all the innovators and early adopters use it, and you get to this peak point where it almost feels like the expectations are a little bit inflated. You realize, okay, maybe we can't do as much as we want, and then there's this trough of disillusionment. But then we bounce back through what we call the slope of enlightenment, where we start getting the early majority getting involved and realizing, okay, there might be something there. And we're going to give this another shot. We're going to tweak things to get to where we want to go. And we're really early in the slope of enlightenment. You can see here on Google Trends where when the pandemic hit, we saw that really massive tech trigger. Everyone got involved in teledentistry. And then they realized, well, we still can't do root canals and extract teeth over video conferencing. So, everyone started to get disinterested again. But now we're starting to see, hey, there are a lot of things that we can't do. There are a lot of benefits. And so we're early in that slope of enlightenment, and we'll start to see more and more aspects of telemedicine permeate our profession. So does teledentistry really fulfill the requirements of Uberization? Is it disruptive? Absolutely. Does it involve mobile technology? Absolutely. Can patients find the dentist they're looking for on demand? Yes. Is there a direct connection between the patient and the provider? Absolutely. Do patients now have the freedom of choice to be able to choose their provider virtually and be able to go through profiles and be able to schedule with them independently? Yes. And they can also follow this up with a review. So all of the checklists for Uberization are met by teledentistry. And it really provides a lot of control, but not only to the consumers, but a lot of convenience as well. Patients are now able to access care and get second opinions, be able to ask questions directly from the comfort of their own home. And really the entire customer experience has been improved and changed. And we'll go over some statistics about what patients are actually saying about telemedicine. And the connection, now the direct connection between the patient and provider can now be established. Sometimes we don't need to go through the front office and the secretaries to be able to reach the providers. And patients can go directly into communication with the provider based on their availability. And comfort, again, people can do this from the comfort of their own home. They can do it from a business, from a senior center. But it's also allowed this new wave of opportunities for clinicians. Associates who may not have, own a practice can now participate in virtual care. New graduates, without having to purchase an entire practice, can now participate in providing direct patient care. And even providers that are retiring can now continue to maintain some level of involvement in patient care, even if they're not doing clinical dentistry. And even dental hygienists who previously had to work for a provider in a dental office are now able to create their own businesses and be able to utilize telemedicine to create new financial opportunities for themselves. Unfortunately, in dentistry, we've always seen a slow adoption of technology. And this has been well documented. Partly this is because of policies and a slow change of the different types of legal and legislative components that really drive our profession. But also, I think dentists have experienced a slow adoption because sometimes we're just a little hesitant to change things. It's mind-boggling to see dentists still utilizing paper charts. And really the amount of dentists that continue to use, traditional x-ray films, or the lack of implementation of CBCT is really alarming, because these technologies have been around for some decades, and we still have a good portion of our profession who still really hasn't adopted these changes. What I believe is that the consumers will really drive this adoption, because we still continue to see millions of patients end up in emergency rooms instead of dental offices to address emergencies. Still have millions of Americans with no access to oral care, which is unbelievable. Many of whom who actually do have dental insurance. And you can see here an example of a man who had to pull his own tooth because he was refused an appointment. And he was in so much pain that he had to actually pull his own teeth. And can we do better? Is there a way to kind of avoid these issues and be able to give consumers the access that they demand? So this whole paradigm shift that's occurring in dentistry and really being driven by preventative care, on-site care, has been very well documented. There is no doubt, there is no question anymore that there are massive benefits to the implementation of teledentistry. This has been documented and repeatedly. Paul Glassman, who is really the godfather of teledentistry, has had years and years of research. But I think now we're seeing even insurance carriers and even academics really publishing on this and releasing white papers showing that there are clear advantages, not only for the patients, but providers to implement telemedicine and on-site care. And you'll see here a list. I won't go too much into it, but patients, when care providers are winning, the quality of care goes up, and really minimizes a lot of the costs and burdens that we're putting on society and our caregivers. The reduction in missed school hours for our youth, and really also minimizing the oral health disparities between different types of subgroups within our population. Unfortunately, as I mentioned, the legislative branch sometimes is slow to adopt. We have states like Texas who have completely outlawed teledentistry. And I'm happy to report actually to our viewers that even the state of Texas now has brought over bills that are in the process of being passed. And so even the state of Texas will have teledentistry soon. And we will have legislative capabilities to continue to improve and modify these rules until we really get them to where we need to go in a consistent way across all the states in the United States, and then across the world and the globe. So let's talk about some of the benefits. And what are some of the just obvious benefits? Avoiding traffic, being able to access a clinician without having to sit in traffic or not have to sit in the waiting room area. We have over 164 million work hours that are lost for even patients who have dental insurance, who have great jobs, having to lose out on at least 3 to 4 hours just traveling to the dentist for basic checkups or for follow-ups. We have the logistic issues with disabled and geriatric patients on how to actually get to the dental office. And a majority of the patients who have emergencies end up taking opioids and being given opioid medication just to alleviate the pain until they can figure out what to do. And really one of the biggest challenges we've had is just the fear and anxiety of going to dentist, and the anxiety tripling just in the waiting room area. So if we are able to change the location and the environment in which we treat our patients, we've seen a dramatic decrease in anxiety and fear, allowing us to take care of these issues earlier and really not let them get out of hands. And we've obviously seen the effect that COVID and the pandemic has had on our industry with the shutdowns, increasing the rate of admission to emergency rooms, and then really being able to now provide a global ecosystem where dentists and patients can participate in and be able to collaborate, get second opinions, and maybe even talk to a dentist that they've had, growing up in another country. And if someone immigrates to another country, they can still maintain that communication with their family dentist, with whom they're familiar. So the COVID-19 pandemic really, really accelerated the growth of telemedicine. We had massive shutdowns, but we still needed some type of continuity of care. And we've seen huge adoption since the pandemic hit. And, dentists are at high risk. We're so close to our patient's mouth. So being able to reduce some of these risks, not only for the patients and staff, but also for the doctors as well. But nevertheless, we still have a massive shortage of access to care across the nation, which is really something that can be easily addressed with telemedicine. Now, I'm very happy to announce that the ADA really had jumped ahead of this even pre-pandemic and really accelerated the adoption of telemedicine and mobile dentistry. They lobbied Congress and finally got Congress to pass new legislation in 2018 to allow mid-level practitioners to go out there and actually provide on-site care and to be able to implement telemedicine services to various capacities. And really, really proud of the ADA for really taking this consumer demand and evaluating the benefits and proactively lobbying Congress to implement some of this legislation. But outside of the American Dental Association, we've now seen massive institutional and corporate adoption. All the DSOs are now implementing various aspects and capacity of telemedicine. But we also have major retailers. We have groups like Google, Amazon, CVS, Walgreens, who are all now promoting telemedicine services and who are getting involved in making sure that consumers have direct connection with providers, even from the pharmacy, even from, sometimes even from their grocery store. And so you'll continue to see more and more institutional and corporate adoption of teledentistry, and this is something that is not going away. In fact, if you want to see how proactively our dental boards are getting involved in this, it's interesting to note, just a couple of months ago, the American Association of Dental Boards met, and the main corporate sponsor was actually Smile Direct Club. And really, some may look at this as a negative. I actually look at it as a positive because we have to internally realize that if we don't make some of these changes and we don't implement some of these new innovations, we will have corporate interests that will do it on our behalf. So in this situation, it's really nice to see the dental boards getting involved and at least opening up a conversation and communication with other teledentistry and telemedicine companies, and making sure that whatever we do it in a way that better serves our providers and our patients. Now, healthcare will follow the retail model. You'll see right now we have Walmart, CVS, Rite Aid, Albertsons, Walgreens, all implementing on-site teledentistry and telemedicine services. And we have even beta tests right now that are going on with companies like Smile Direct Club directly piloting some of their services directly in Walgreens and other major retailers and pharmacies. So we're really just getting started, and patients will be able to now take intraoral scans and even impressions at their local pharmacy, in addition to getting triaged and getting the medication they need. These are examples of telehealth kiosks that you will expect to see. Many of them are already being implemented. So patients right next to the pharmacy will be able to take their blood pressure. They'll be able to assess their glucose levels, be able to assess even EKGs, ECGs, and be able to take intraoral scans and intraoral pictures and videos of the oral cavity, and be able to have a remote dentist assess that situation. And really interesting to see actually Uber getting involved. The new appointee as the general manager for his health business is actually Ms. Donovan, who has more of a decade of experience managing an actual dental company. So even Uber realizes that there's a huge opportunity here to really expand their services, utilizing telemedicine and implementing some of these new workflows that are available now. So let's discuss one case example of how telemedicine can really revolutionize patient care. Pre-pandemic, there were over 2.2 million million patients who would end up in emergency rooms. And as we know, most of these emergencies generally occur after hours. Some of them are true emergencies and some of them are not. So patients lie down and, you know, when they're lying in their bed, all of a sudden they start getting pain in, you know, a tooth that may need a root canal. And the change in position while as they're lying down is really the cause. And so at 9, 10, 11 p.m., most dental offices are closed. They end up having to go to the emergency room. These type of emergencies and admissions occur roughly every 14 seconds, whereas we can see a lot of these patients address these emergencies within minutes, utilizing telemedicine, and really avoiding patients having to go to emergency rooms where they're very low priority patients. They end up waiting 3 to 4 hours to get care and often end up leaving with just some antibiotics and opioids. So can we do better? Can we save billions of dollars for emergency rooms in the healthcare industry? And can we reduce some of the costs that our patients are having to pay? Oftentimes the cost of care at the hospital setting is 3 times as much as it would be if we can address these issues in a traditional dental office. So we have billions and billions of people around the world, even in the more developing countries and underserved communities. Everyone seems to have a cell phone. So this is a unique opportunity to actually really address a lot of these issues on hardware that pretty much everyone has around the world. So here in Los Angeles, we have a huge homeless problem, but pretty much all the homeless people here have cell phones. So we can now address issues in real time, on demand, and directly on the mobile phone of our patients. And here you'll see examples. You know, sometimes you can diagnose, sometimes there really doesn't require a diagnosis. A patient thinks, you know, when they see a little bleeding around their gum, they freak out, they think it's an emergency, they end up in the emergency room. And these are things that we can address relatively quickly. We can see some patients who are swollen, who have a fracture of a tooth, or have a porcelain fracture. And this is just an opportunity for us to alleviate their concerns and be able to tell them that this is not a true emergency. This is something that can be seen in the office the next day. And sometimes it is an emergency. We can, you know, prescribe some antibiotics, some analgesics, and then let them know that they can meet us at the office either the same night or the next day, and be able to avoid having them go to the hospital setting. Now, if necessary, we can triage these patients, and then utilizing that same platform, send a prescription directly to the pharmacy, and the patient can, you know, get the medication they need and immediately be seen at the dental office right after. I'm really proud to announce, actually, with the AOS, Dentulu has created what we call the Fast Track Hospital Aversion Program, where instead of having these patients spend, you know, the critical 10, 15 minutes Googling, Yelping, trying to find an available dentist, oftentimes unsuccessfully, and wasting about an hour or two just trying to figure out where to go and ending up at the urgent care, we can now have them just go directly on their cell phone and immediately get connected with a licensed dentist who's in that area and who can triage and address their emergencies. But even if they end up in the emergency room, we have teledentistry kiosks that we can place in the emergency rooms, urgent care centers, and even in pharmacies, where patients can go directly to the kiosk, connect with a licensed dentist, and then address their issues outside of the actual emergency room setting. Now, another opportunity here is to actually help address any oral health issues for people who are admitted. So even patients who are admitted in hospices, hospitals, senior centers can now have these teledentistry hospital carts placed directly on site. The dentist can now come to the actual location, be able to do, you know, restorative, preventative, all types of different types of dentistry on site. And we all know how important oral health is to general health. But really, the logistic issue of getting a lot of these patients out of the hospital and into a dental office is daunting. And these types of carts now allow us to not only communicate with our patients directly from where they're located, but actually allow a mobile clinician to come on site and perform dentistry without having to worry about, you know, plumbing and vacuums and suctions and compressors. All of these are put together on one cart, And you can really do the full gamut of dentistry on these carts. I've done root canals, extractions, fillings, crowns, bridges, and even implants on site using similar carts. So the workflow is really consistent, whether you're doing, teledentistry in the form of synchronous modality or asynchronous. For the patients as well, there's a specific flow that we'll see. Patients can sign up and register. They'll select and review different doctors. They'll book an appointment with that doctor, receive confirmation that that appointment has been validated by the provider. They'll do whatever type of interaction, whether synchronous or asynchronous. They'll pay for the event. And then at the end, they can review the doctor. So you can see that full range of Uberization included in these workflows. And for the doctors, it's very similar, right? You sign up, you create a profile, you set your availability. As you get requests for appointments, you'll approve those, you'll interact with the patient, you'll collect payment, and then possibly prescribe a medication or bring them into the office for on-site care. So here's an example of a patient experience. Here you have a patient who's registered. They can even choose, their favorite scents. They can choose a preference of the gender of the provider. They can add additional family members and dependents, and they can actually control those. Very similar to what you see in Uber. Patients can now set up a profile, add family members, update their health history, update their addresses, put in their insurance information. And so the first part is just setting up the account. Then they can browse through different profiles. They can actually go into different categories of what they're looking for. So if someone wants a cosmetic dentist, or if someone wants a holistic dentist, a geriatric dentist, we can now have them just go into these different types of categories, review the different profiles, see the ratings of the doctors. And then once they read up on the doctor, they can read the bio, and they can see the schedule and available times. Then they'll go ahead and sign consent electronically. They'll pay for the visit, and then they'll be connected with the dentist in as little as 5 to 10 minutes. So if it's an emergency, we try to connect them with the doctor immediately. And if it's not an emergency, they can schedule for the next day or for the next week or even for the next month. Now, equally interesting is now implementing some of these remote patient monitoring tools. So just like we have patients in the medical profession monitoring their glucose or their blood pressure or various aspects of their health remotely, we have all these different wearables. We're now starting to see actual remote patient monitoring tools implemented in teledentistry. So here you have a simple attachment that can be placed on a mobile phone. It not only serves as a retractor, but it also illuminates the oral cavity and allows clinicians to see real amazing images of teeth, of the gum, soft tissue. We can circle, we can measure, we can point, we can share this with other clinicians, and then patients are able to share their own pictures and videos with doctors as well. We're also really happy to introduce a new wave of educational remote patient monitoring intraoral cameras. The MOUTHCAM is a very affordable intraoral camera. Patients can be given these types of intraoral cameras to take home with them. So after an extraction, after soft tissue grafts, or even as an educational tool or early detection tool, we can now provide these cameras to our patients and be able to monitor their oral health remotely from thousands of miles away. It's really interesting with the MOUTHCAM. We have different versions where you can connect it to your mobile phone, but we also have others that you can plug into the USB. And we also have a new line of MOUTHCAMs that actually have hygiene attachments. So we can now put proxy brushes and floss and implant cleaning attachments and have their patients not only see what they're doing, but also see where they're cleaning. And the doctor can now remotely monitor these the hygiene patterns of patients. We can also utilize these cameras to detect early cancerous lesions. We can detect open margins. We can detect all types of different pathologies remotely and be able to address them quickly. So here you see a patient who has their mobile phone up. You can see actually the proxy brush attachment, and the patient can actually see where she's cleaning in between, furcations and bridges. And these are now potentially going to be billable events. So providers can not only monitor their patients' hygiene habits, but they can actually bill for some of these services. And as I mentioned, with the introduction of artificial intelligence, we can identify recession, oral cancer. We can identify tons of different issues utilizing the technology, and the patients can do this directly at their home using their cell phone, take a picture, have AI assess that picture, and then be able to alert the family member or the clinician that there might be something wrong. Artificial intelligence will also allow us to assess the patient's emotion in real time. So imagine being able to talk to your patient and treatment planning them and see how they're feeling in real time as you speak to them. You can tell if a patient is upset, is scared, is motivated in real time as you're communicating with them. And also just in cosmetics, you can see the different proportions, the lengths of the face, how to properly assess the patient's facial symmetry, the smile line. And really, these are incredible tools that we can utilize not only in telemedicine remotely, but also in our offices. So let's talk about mobile dentistry a bit. So the same way that you would expect to open your phone and find an Uber driver in your area, you can now open up your phone, create a profile, and see all of the mobile clinicians in your area. So dentists, hygienists, associates can immediately become mobile clinicians, and they can purchase the mobile equipment at a very affordable price. These carts now range between $2,000 to $5,000, and they allow you to do the full gamut of dentistry with simple carry-on cases. And this is something that someone can do on the side in addition to clinical work at the traditional brick and mortar location, or they can do this full time and provide mobile care directly in hotels, in homes, in different areas. And so patients can come up there, they can decide. You see here on the upper left, it says, put the zip code where you want the care. Do you want it at a house? Do you want it at a business? Do you want it at a senior center, or is it other location? And what are the services that you're looking for? And based on those filters, it will find mobile clinicians who are available in that area. And so, as I mentioned, we can now provide mobile dentistry effectively in apartment buildings, in senior living centers, hospices, office buildings, universities, factories, elementary schools. And really, the mobile dentistry goes really hand in hand with teledentistry. Just imagine being a senior or a geriatric patient or a disabled patient. Imagine wanting to go to the dental office just to get a checkup. Now you have to oftentimes reserve a car to come pick you up 1 week in advance. They give you a 3 to 4 hour window where you have to be available. They'll come and pick you up. They'll take you to the dental office. And God forbid that the appointment runs a little bit over. Just imagine the logistic issue one would have to endure just going to get a regular checkup. Well, now we can send one of our hygienists. If a patient has been a patient of ours for 20, 30 years, the patient is now not really mobile anymore. Maybe they're disabled, non-ambulatory. Instead of discontinuing service with those patients, we can send our own hygienists directly on site, have them go provide the preventative care that the patient needs, and really maintain that communication and care for our patients even throughout their senior years. So this includes nursing homes, and it also includes businesses. It was really amazing to see. This is one of our teams that was providing on-site care at Patient Pop. But we've gone to Google, we've gone to Netflix. Now these corporations are realizing, well, we have dental insurance, we have medical insurance, but it's really inefficient for us to have our employees leave, sometimes miss the entire day to go to a medical or dental appointment. So why don't we just do this on site? So they have haircuts coming on site. They have entire corporate wellness programs where they bring yoga, they bring meditation, they bring haircuts, they bring everything on site now. And dentistry is no exception. We have a lot of companies that will do a pop-up, and here you see a pop-up in a small room or a conference room, and the patient can sit down, relax, they come down from their office, they already have dental insurance. All of this is actually covered. There's usually no extra fees for them, and they get to actually have preventative care done on site. Now, we can also take intraoral scans of the patient. So if we need to send a night guard, a whitening tray, clear aligners, partials, this can all be done, and really the process initiated directly on site. And then for the things that we can't do, or maybe the doctor doesn't feel comfortable doing, we can go ahead and send it to our office. And they already have a great patient who's been introduced to your practice, who has dental insurance, and who can likely afford the dental care they need. And we also see now a movement of doing on-site care directly in people's homes. I've personally provided on-site care for the Saudi royal family, many homes and residents here in the city of Beverly Hills. I've provided dental care directly in living rooms, and I've done it in sometimes in the bedroom of a geriatric patient, but directly in their home. Now imagine the entire environment is changed. The patient doesn't have to hear the noises or smell the scents that we oftentimes associate with dental offices. And by changing the environment, we can really decrease anxiety for a lot of these patients. And the dentist doesn't even have to go on site in many states. This is something that a hygienist or mid-level practitioner can do, go out on behalf of the dental office. We can free up some of our chairs for more high production cases and be able to have the hygienist go out and see the patient, do the cleaning, take x-rays, take intraoral pictures, send this information back to the office. These are billable events. They free up our chair, and we can expand our office size essentially with mobile clinicians going out on behalf of our office. And you'll see more, robust companies, like Henry the Dentist, on-site care. You can see these really amazing vehicles that are really technologically advanced. I mean, this is some beautiful mobile offices. They're not bound to any one particular area anymore. They can now travel to businesses. They can go out on different types of events, and they can provide care directly in the vehicle. Patients will come, get the care they need, and they'll just go back into their home or residence or party or wherever, wherever they're located. So this is another way to do mobile dentistry, where you don't just do the pop-up directly inside. The patients will actually come outside and go into these vehicles that have been transformed into really amazing dental offices. This is not only limited to dental care, but it's also applicable to diagnostics. So we have great companies that go out and actually provide CT scans directly in the patient's home. So imagine you need a CT scan, you want to get an intraoral scan. You can now have them meet your patient directly at home or at the patient's business. The patient can come outside, take a scan. All this information will get sent back to your office. And if you don't have a CT scan in your office, imagine being able to now, have the advantages of this type of diagnostic tool, but not have to house it in your actual office, and being able to provide the convenience for the patient of having these go directly wherever the patient is located. One of the really important things for us here at DENTULU is to create a national registry of mobile clinicians. So we have, let's see, sorry, I got a little pop-up here. Let's go ahead and get rid of that. So we have a lot of mom and pop practices that are participating in mobile dentistry, but really it's hard for the consumers to find them. So we've created a free national registry of anyone who wants to participate in mobile dentistry. They can register and sign up, and then basically we'll just direct patients to them. So whether they provide on-site care in homes or in elementary schools or in businesses, we really want to help consumers find these mobile clinicians and support their individual practices. So providers, whether they are hygienists, dental offices, dentists, they can now all register for free. The majority of our telemedicine capabilities are free to dentists. So that includes video conferencing. It includes photo consultations, pre-screening tools for, screening their patients, remote patient monitoring tools to be able to follow up with the patients. These have all been put onto one platform. And so everything communicates with each other. It also integrates with practice management software. So providers across the nation and soon across the globe will be able to register for free, put in their license information, and be able to now communicate with their existing patients and new patients for free on the DENTULU platform. And so any dentist that's seeing this in the United States right now, whether you own an office or you don't, you can go to our website and register for free, or you can download it on your app. The way you'll initially set up your account for this and other telemedicine platforms is you will first create an account, update your picture, put a bio. You can have control over what zip codes you want to provide mobile dentistry in, or if you don't want to provide mobile dentistry, you can just provide virtual consults. So if someone is having a question about whether they are a good candidate for veneers or for whitening or for ortho or Invisalign, you can assess these without ever having to meet the patient. And then if they're a good candidate, you can then have them come into your office. In fact, not only can you assess whether they're going to be good patients, but you can also assess whether they can pay for your care, because now we can actually get them approved financially, validate whether they can actually pay for these services before they ever come in. So now you've met the patient, you've screened them, you've seen if they're going to be a good fit for your practice, and then you can also see if they're financially able to pay for the service as well. So just imagine how much time you save and how much reduction you have in the amount of interactions necessary in the dental office by being able to do these things on site and on their cell phone, essentially. You can sign your BAA agreement directly on the platform. You can set your own availability. You can set your fee schedule. And so you can decide, for these type of consults, for cosmetic consults, I want to charge this much. For second opinions, I want to charge this much. And you can really create your own fee schedule and be able to set, different customized availabilities for emergency calls, non-emergency calls, for in-office appointments, and for mobile dentistry. And then, you can pick and choose the different types of services you want to offer. So let's say you're a dentist and, you're an associate at a dental office, but you don't mind going, to provide on-site care. You can pretty much set whatever the specific procedures and services are that you feel comfortable with. So you may feel comfortable doing a prophy for someone, or just doing an extraction, or doing laser teeth whitening. So you can choose the services and then create a price for that particular service. And you can even fill out your 1099 forms as an independent contractor. And then patients will be able to create a profile. Now we have major retailers, big pharmacies, bringing on consumers onto the platform. So a patient who doesn't have a dental office will come on the app. They'll create a profile. They'll basically put in the address of where they are looking for care, or they may not want mobile dentistry. They just might want to talk to someone. They'll be able to schedule new appointments. They'll see, a profile of the doctor. They'll be able to see the availability that that doctor has set, read a little bit more about the bio, the types of insurances the doctor is accepting, and then directly onto the platform, they can, basically request specific dates, times, and locations where they want the care performed. And then the doctor will get that notification, they'll approve it, they'll charge a deposit, and then they'll go and provide the care. So, many of us, I've seen articles, asking, is this just a fad? Is this going to be something temporary during the pandemic, or is it going away? Well, as I, hopefully clearly showed, institutions, retailers, even the insurance carriers are now all promoting telemedicine, promoting on-site care, and actually now creating reimbursement for them. So we are absolutely in the early stages of the implementation of teledentistry, remote patient monitoring. And just like, for me, there's a lot of parallels with when I started practicing dentistry and doing implants. General dentists weren't placing implants. They weren't doing bone grafting. They weren't doing a lot of these services that are now, I think, commonplace in almost every dental office. You have GPs participating in not only restoring implants, but also placing implants, doing surgical extractions, doing bone grafting. Many dentists I know are doing soft tissue grafts. And so I see those parallels occurring where initially we thought, this is something that we don't think general dentists are ever going to place implants. But now we see that, this is commonplace. And I think the same type of adoption curve is going to occur in telemedicine. It is definitely here to stay, and it is definitely in the early stages. And I think it's really advantageous for clinicians to familiarize themselves with this technology and start utilizing it in whatever capacity they want. And really, I think that whether we like it or not, the consumers are going to demand it. I think that for the most part, patients are all now very comfortable with having medical, telemedicine visits with their doctor. From talking to a psychologist or psychiatrist, or just having a immediate connection with their family practitioners, they are already utilizing these services on the medical side, and I think they'll now demand it on the dental side. Why not have a patient just take a picture of their smile or their bite and be able to send it to a dentist, and be able to assess whether they would be a good candidate for ortho, or to be able to assess whether that broken filling is something that's an emergency, or something that can wait. So that convenience is something that this new generation of millennials are demanding, and what it seems like is that the majority of the responses have been good as well. So we have multiple studies that have been published from DentaQuest, multiple white papers, not only showing increase in efficiency of care, decreasing costs for the patients, but also increasing the revenue potential for the providers who are implementing these technologies. And patients love this, right? 86% of patients that were, participated in these surveys said that they would love to use teledentistry again. In fact, many of these patients would choose to utilize telemedicine for the convenience factor over the need to go into a brick and mortar office. They were able to have their concerns addressed, and the majority of them will actually recommend providers who are implementing certain levels of telemedicine to others. And really, this Uberization and bringing all these services and digitizing them onto this new ecosystem also presents really incredible new opportunities. So we have all of these features now together on one platform, and we're already using computers, we're already using our cell phones to participate. Now, can we get other benefits out of this? Well, on the patient side, there's a lack of dentists, so they can get access to care, reduce the amount of emergency room visits, be able to get second opinions, and also financing directly on these types of platforms. But really, the dentist can profit by decreasing some of their expenses. We don't have to spend as much time on PPEs. We don't have to spend as much time in our operatories screening patients that may not be a good fit for our practice. We don't have to run marketing campaigns and really have a surprise when the patient shows up to realize that this patient is not going to be a good fit. We can screen these patients before they ever show up to our office. And so there's so many benefits to these pre-screening and patient monitoring tools, but we also have these additional benefits. Can we reduce COVID exposure? Can we also tack on some of the other things that we utilize? Patient education. So if we're already communicating through this technology, Can we have patient education implemented? Can we have payment processes? Can we send our forms digitally and have all of the health history collected before they come in? Can we have them do all their consent forms digitally before they come in? And the answer to all these is yes. Can we do our appointments and our review management on this type of ecosystem? And the answer to all of these is yes. So we really believe that this paradigm shift is occurring where these all-in-one solutions, not only just mobile dentistry and telemedicine, but all the other really components that we require to run our dental offices can now be added on to this type of ecosystem. So, our platform has really done that effectively by taking all of the different aspects of telemedicine and putting them onto one platform where they all communicate with each other, and it's all free. So providers can have access to communication tools, to digitized forms, to patient education, to video conferencing, to chatting. All of these things can be done directly on this platform and at no cost. So patients can go, and download their own app on an Android, on an iPhone, or directly go on the web and register. Clinicians can do the same, and even companies who provide services to the dental industry, including the insurance carriers, including some of the supply companies, can now participate in this ecosystem and promote their services and products as well. So my recommendation in wrapping up is just do it. It's not going away. It's just getting started. Get involved in telemedicine organizations, teledentistry organizations. There are conferences now specifically dedicated to telemedicine and mobile dentistry. There are podcasts. Clubhouse has an incredible group. They have Teledentistry Tuesdays where you can learn a little bit more, and really start participating and involving your staff, your associates, your entire operation in this new technology, and you'll see that the benefits of Uberizing your practice will really continue to pay off over the next couple of years. And as this massive adoption continues to grow, I think that familiarizing yourself with it early on, and it's all free, so there's no fees and there's no added expenses, and I think the benefits outweigh the risks, and really hope that this benefits our providers and then allows everyone to kind of communicate in this new ecosystem together, not only here in the States, but across the globe. So with that, I want to thank you for your attention and for being part of this doctor-to-doctor movement, and really want to thank the Global Summit, the AOS, Dr. Shaw, and everyone else who has taken the time to put this amazing platform together. And I hope to have the pleasure of speaking to you all again soon and sharing more updates about new innovations and technologies in dentistry and how we can utilize those to better serve our patients and have more amazing practices. So with that, I'll stop sharing and I'll take any questions, Bill, if you might have.
Hey, outstanding presentation, Arash. This was disruptive, is the word. You turn over a rock and you don't know what's going to come out from under it. A lot of people turned over this rock today, saw this presentation, and they were blown away with concepts they never thought existed in medicine and dentistry. So good job. I see that telemedicine and mobile dentistry has matured a lot since I started doing some of it. It's more robust because of the efforts you and others have put together. I remember going out in the Baptist mobile unit and parking it in a place and doing dentistry for a day. I remember joining an app called Health Tap, where we would field questions from patients, but we felt so helpless because we couldn't do anything but answer questions. We had no way to interact with them and get information. So I think your MOUTHCAM is going to be revolutionary. Things like that. Excellent. So I have a question about.
Go ahead. What's the question?
I have a question about vetting of patients who want opioids. How do you kind of screen those out?
I don't prescribe opioids on telemedicine. There's no need to. So if it gets to the point where I have to prescribe opioid medications, I'll have them come to the office. But I will address their emergency. I'll inform them. I'll communicate with them. I'll screen them. I'll even qualify them financially. But personally, I don't have a practice of providing opioid medication, and there's no need to.
Excellent. What about monetization for the dentist that actually performs the services? Travel time is downtime. Do they make up for that in additional charges, or do they just hope the patient will become a better patient in the brick and mortar office later?
Well, so there's different ways, right? The dentist doesn't even have to go out in many of these events. The dentist can send a hygienist or mid-level practitioner to go out and perform the hygiene services, do the exam, take intraoral pictures, and then the dentist can, it could be a retired dentist sitting at home and monitoring these events, and then just giving permission to the hygienist to provide the care. Dentists also can provide a number of services without ever leaving their home. So we have retired dentists who are sending impression kits, for example, directly to the patient's home. So you can screen them virtually, send an impression kit to the patient's home. Then the patients can take an impression, or they can go on site to one of these retailers and take an intraoral scan. And then the dentist can basically evaluate the case, be able to recommend a night guard, be able to recommend whitening trays, be able to recommend even valvoplasty partials cannot be done. Single tooth replacement options can be done without the patient ever having to come to the office or the dentist having to leave. But should on-site care be necessary, the dentist can have the liberty to choose, in many places, whatever they want. Personally, I used to charge $500 just to show up. This is outside of the services. So if you want me to come to your hotel room at 9 p.m., it's going to cost $500. And when I get there, I'll assess the situation. I have a Nomad. I'll take an X-ray. I'll do my probing and do whatever it is necessary. And I have my equipment that I can take with me. And then we can go from there. We can charge your insurance, or we can charge, just direct fee for service. So it really depends on the situation. You can also go on site to a business and have an entire day's work just already ready for you, right? There's about 10 to 12 patients. You can do all their cleanings and basic care. You can do intraoral scans. And by the end of the day, you've made, several $1,000s of production. All the payments, are covered usually by their insurance. Preventative care is usually covered at 80 or 100%. And so you have a full day schedule, and all these patients now, you're not going to do cleaning, you're not going to do fillings and implants and bridges, at the business. You can now take them back to your office. So you have great patients who have insurance and now who have, a connection with your office. So what's the patient acquisition cost for most dentists? New patient acquisition cost is between $250 to $500 for a new patient. So sometimes it makes sense to be able to bring that, that care on site and really use that as an opportunity to gather new patients.
And I can see these mobile carts being placed strategically around the community would allow a mobile dentist to go in and serve a population on a rotating routine basis.
Yeah, absolutely. Imagine being able to move your office to wherever you want it to go and not have to be bound by, any of the changes. We have some areas that are now so heavily populated with homeless people. So you have a dental office with, 100 homeless people outside, and imagine just being able to move your office to another city, and whether it's temporary or permanent, having that capability to now have a traveling clinic that is probably going to be 1/10 of what your cost would be at a brick and mortar office. You can probably get one of these units between $70,000, $80,000, make some payments on it, and now you have a fully capable office that you can provide anything from preventative care to ortho to restorative care, extractions and surgery. All this stuff can be done in these kind of vans. Or if you really want to go lean, you don't even need a truck, right? You get a mobile chair that you can just pop up. There's a one of the carrying units cost maybe from $5,000 to $10,000, and now you have a fully mobile practice. You can put this in the back of your trunk and just pop up the chair. It has a compressor, it has a vacuum, it has a suction, it has everything in the unit. And so for $10,000 to $20,000, you can have a fully mobile practice, and you can do this on site inside even patients' homes.
I know we both cut our teeth on missions around the world in Africa and South America, places in Central America, and this is just a growth of that same concept of doing mission dentistry. You're just doing mobile dentistry.
Same concept, and really, you know, I think you can appreciate. You've been to Kenya, all these amazing places. Now, here's what I had to do to volunteer, and I've been to Guatemala more times than I can count. I mean, I've so many of these places, but I had to miss work. I had to leave work. I had to find an associate to replace me. So I wasn't making an income. I had to pay an associate to replace me. I had to pay for my travel. I had to pay for my food. So just going out there wanting to volunteer was sometimes a huge challenge. Now imagine being able to provide care to a really remote area all through telemedicine from the comfort of your own home. You can volunteer any given Sunday and be able to triage patients, be able to actually see inside the patient's mouth thousands of miles away, tell them what's going on, you know, even maybe provide some recommendations, and really help the people on site do their work. And then if you do provide on-site care, if you do go out there and volunteer in one of these remote areas, now being able to come back home and actually follow up with those patients and be able to monitor those patients and how they healed after those extractions, instead of just going out there and pulling some teeth and not knowing at all how the patients healed. So I think this will really open up a lot of doors for volunteer work. And the Dentulu Smile Foundation is a free telemedicine nonprofit where any provider around the world who wants to volunteer can now sign up and register, and we'll match them with mission groups, and they can provide volunteer services from the comfort of their own home and on any time in any location of their choice.
That's an excellent service to the world that Dentulu has put together, that foundation, and that's a good segue to finish up. What I've got to mention at the very end here is our connection to the On-Passive Academy teaching platform, and I want to make sure as we finish up that everybody realizes that the trimurl.co/global summits is an important URL to go and register, be a part of that teaching platform for the future. And every doctor who's a part of that platform will also be a part of a global group of over 1 million people who are seeking to serve others around the world. So we're uniting doctors, we're uniting foundations and nonprofits all around the world to serve people. And your product and your concepts of teledentistry, mobile dentistry fit right in. So thank you, Dr. Arash Hakhamian, and we will move on now to the next lecture in the Global Summits Institute. Thank you all for attending today.
Before we go, I want to also recommend that everyone who's interested in participating in the AOS Fast Track, the hospital aversion program that AOS has put together, to go to oralsurge.org and be able to register yourself. So a lot of these patients who are now ending up in emergency rooms will be diverted to local offices. So if you are interested in helping this hospital aversion program, create yourself a profile with AOS, and we can give you the full gamut of these tools of that you need to be able to screen these patients, and then we'll be able to funnel these patients away from the emergency rooms and to your local offices. So again, thank you for AOS, thank you Global Summits, and thank you all for having us today, and I'm looking forward to the next time we meet. Thank you so much, Bill.
All right. Thanks, Arash.
All right, talk to you later. Bye-bye.